When I first came to Cedars, I was doing more basic science research, and then I got more clinical, and then we're doing experimental work in therapeutic ultrasound, and then in the last 20 years it's been more clinical work in ultrasound with patients, and in the last decade it's been working in structural heart disease and treating patients with transcatheter therapies to either replace or repair valves. What we've seen is a revolution in therapy. When I first joined Cedars, we were doing balloon angioplasty for coronary disease, and that went to stents. Then it wasn't even a dream on the horizon that we would be able to replace an aortic valve with a catheter-based therapy, or that we'd be able to repair a mitral valve with a catheter-based therapy. And now these have become realities. At our institution, we've done, in the United States, the most of mitral valve percutaneous repairs and aortic valve replacements percutaneously. Teaching is part of my essence. Doctor means to teach, like from the word doctrine. So I think it's, and you know, we used to say, learn one, do one, teach one. And I think it's very important. It's part of what we do as doctors. We want to always build for the next generation, make our peers better, and as well as make our trainees to optimize their career. And that's great satisfaction, seeing the people that you train go out and evolve and become successful. The other important things to me about teaching is if I see a patient or I'm reading an echocardiogram and it's by myself and it's a fantastic case, whether it's an echo or it's a very interesting patient that's some complexity and interest, doing it by yourself and not being able to do it when you're teaching is like watching a sunset by yourself. It's still magnificent, but when you're teaching, then that's what makes it even more fulfilling. It's like sharing that sunset with someone else, and that's a great feeling. I think the thing that I've learned over time is the importance of listening to the patient. Sometimes you can't do anything, but at least listening can give the patient great satisfaction. And so I've worked with students, pre-medical students, residents, cardiology fellows in training, fellows that come from other countries that are cardiologists that have come to work with me. And I found that very rewarding because whatever I give, I get back to a great extent. And I think the great thing about teaching is you learn. You always are learning, and you can learn from anyone, especially if the naive question is often the profound one, and it makes you look at something in a totally different way. I think medical students are protoplasm. It's hard to know what you're going to do until you're doing it, until you're involved in it. So I think sometimes they come with a notion that they want to be a surgeon, that they want to be a psychiatrist, or they want to be a family practitioner. But until they've worked in those areas, they can't really know what they want to do. And I think the other thing is that certain people derive different senses of satisfaction out of different types of practice. Since the Affordable Health Care Act, there are more applications to medical school. And I think that most people that are sincere in the field want to be able to provide access to health care for everyone. And we're one of the top cardiovascular centers in the country. And what's so terrific about it is, one, we have the resources to give patients the optimal treatment. And number two, I have colleagues that when I have questions, I'm getting answers and help from the best people in the field. So it's like being on a great team. And so when you're on that World Series team, the other players are so good, it lifts your game. And so it's very exciting. I think we feed off of one another and we learn from each other.